I think the Ministry of Health has been very supportive of the idea of using TMOF with BTI. I mean, BTI is very expensive, and the fact that you've got to put it every week means the cost is very high. With TMOF combined with BTI, you're able to reduce the dose by half straight away, and the frequency application from once a week to once a month. That's an immediate, direct 8-time cost reduction. Now, there's also a big cost in actually applying the material at four times a month. So there's another indirect cost to it as well. So the MOH was from day number one very supportive. The team that was at the vector control division, the team that was at the administrative side, have always been supportive of not just the cost implications but also the logistic implications of TMOF, combining TMOF with BTI. Obviously, you know, the other thing is that when you combine them both, you get very high kill rates, and therefore you get no resistance, which is a big issue with mosquito control. And so you have reduction in cost, reduction in application rates, and improved logistics, and no resistance. I can't see why any authority in mosquito control would not want to give this a favorable first try. And if they did, then they will be very pleased with what they're getting. The response was very good. I mean, there were a lot of initial anxiety about the product, and there was concern about involving people on the ground. But once they got going, I think despite the rains and despite the fact that the infections on dengue increased all around the area, specifically in Gombak itself, we had a 20-week period without infection, which I thought was phenomenal. Oh, that's the best thing about mosquicide. You retrofit whatever you have with the product. You don't need to develop a new delivery mechanism. Same staff, same people, same equipment, you know, same sprayers, what have you, and all that. There was absolutely no investment in terms of hardware to deliver this treatment, this infection control product. So yes, there were several trainings on the ground done by Dr. Alan Brand of Endogenex, along with my people, and it was very easy to do because it was already well established, and we were not making more work for them, we were making less work for them. So it was easier. There was far less resistance than we thought we would have from people on the ground.